Welcome to Drive-Thru Therapy. Today's video is on the important differences between people being clean and sober and people being in recovery. The differences are clear to those who have experienced both phases of their healing process from substance abuse. Some people have reported that one day they wake up and they are feeling different and energized and are eager to continue with their recovery. I want to caution people here. Sometimes it's not the recovery phase that they're really feeling, but something called the halo effect that some people are feeling. This usually occurs around the 30-day period for some. This can be a dangerous time because it can lead to a false sense of what I call the I got it syndrome, which they really do not have. The clean and sober client who is not presently using alcohol or drugs, however, has not changed his past using lifestyle, nor come to comfortable terms with the need for a permanent recovery. He or she is ambivalent about life, where the recovery person looks forward to his new life, or their new life, of sobriety. The sober person feels abstinence as a constant sacrifice and frequently thinks about using. The recovery person sees abstinence as a gift to themselves. The clean and sober person continues the self-centered ways of their past, maintaining old behaviors, friends, activities, and lifestyle. He or she doesn't take care of themselves physically or psychologically, and continues to suffer from guilt and shame because he or she has not come to terms with their past or present life. People who are merely just clean and sober have a much higher risk of relapse than those who have made the major lifestyle changes necessary for a successful long-term recovery. The substance abuser who is in recovery is essentially in remission from their dependency. Their dependency is not cured, but is being managed in a way that allows them to be free of their cravings, mental obsessions, and they have treated their underlying issues such as mental health, spiritual, physical, that have led and resulted from their using. They have started to make significant lifestyle changes like being honest and non-manipulative. These addicts have found ways to fill the void satisfied by substances through spirituality, emotional or behavioral solutions as they have learned through treatment, therapy, medication management, and or mutual self-help groups such as AA, NA, and Smart Recovery. He or she has gained confidence that the support systems and tools learned in treatment and recovery work is starting to take hold. That guilt has been replaced with hope. This is a time of stability and of becoming comfortable with recovery. However, abstinence alone does not necessarily mean a successful recovery is underway. Other suggestions that were stressed were getting rid of all old phone numbers of their drug dealers or using contacts from their phones, cell phones. If they went home from work a certain way and most always stopped at a certain liquor store or a bar, to take another route home, even if it was a longer ride. One of the most important steps to recovery is to learn how to deal with your feelings that you may be having, many mixed emotions that will surface along with some depression that is normal but needs to be addressed. My advice here is to find people that you deem safe and trust to talk to and vent on how you really feel. Your feelings may be amplified at first due to the changes in your sensitivity because there is no substitutes for the substances in your system to numb your feelings. One way that I tested clients was with $5 bills, five $20 bills. I would show the 520s and ask them to tell me what they would honestly see. Most of the clients in early treatment would see so many bags of dope, 3 perk 30s, so on, and so many bottles of alcohol, what have you. When I did the same exercise with people in later stages of their treatment, these clients would see things that they needed, such as material things that they wanted or needed, an indicator that these clients were getting closer to transitioning into early recovery. Another major sign is when the client can't remember how many days they've been clean. As we know, if someone is struggling, they can tell you exactly how many days and right to the second sometimes, or to the minute that they've been struggling. Another suggestion is to make sure you finish everything, and I mean everything, even if it's a puzzle that you started as an example. Most of the time, people who chase their recovery find it sooner than those who go through the motions, as they say. I tell clients to chase their recovery like they chase their alcohol and drugs, and they will get it sooner. In my experience, I have seen people starting to transition as early as 90 days clean, but for most, it's not until around the 1 year, 9 months to 1 year, give or take. Again, just as stated earlier, many never get to the recovery phase due to not making little or no significant lifestyle changes, dealing with underlying issues, having little or no support system in place that are needed to maintain their recovery. Also, when one is in recovery, there are benefits. Here's just a few, to name a few. People are moving forward, not so hung up on their past. Improved coping skills, feeling happier. Improved quality of life, having purpose again in their life. Improved parenting skills, improved mental health, and improved communications, just to name a few. So in closing, I hope this video has been helpful, and stay tuned for some of my other videos on happiness and anger management, to name a few. Thank you.